Hi, this is Marquita Brown, and today's topic is African Americans and clinical or major depression. Major or clinical depression, frequently referred to as simply depression, is more than just feeling sad or going through a rough patch. It's a serious mental health condition that requires understanding and medical care. Left untreated, depression can be devastating for those who have it and their families. Fortunately, with early detection, diagnosis, and a treatment plan consisting of medication, psychotherapy, and healthy lifestyle choices, many people can and do get better. The prevalence of depression in African Americans is controversial due to the lack of research. The deficit in the knowledge and skills in treating depression in African Americans have not been adequately addressed so far. Inadequate and insufficient data on African Americans contributes to the problems of underdiagnoses, misdiagnoses, and undertreatment of depression. The National Study of American Life survey reports that the lifetime prevalence of depression is higher for whites at 17.9% than for African Americans at 10.4% and Caribbean blacks at 12.9%. But when the course of depression is considered, African Americans' depression persists for a longer duration. Only 19 empirical studies focusing on depression among African American men were identified in a 25-year time span. Findings suggest the prevalence of depression among African American men ranges from 5 to 10%. Major depression is considered a chronic disorder for blacks. Depression does not have a single cause. It can be triggered by a life crisis, physical illness, or something else, but it can also occur spontaneously. Scientists believe several factors can contribute to depression, which include trauma, genetics, life circumstances, brain changes, or other medical conditions, such as those who have a history of sleep disturbances, medical illness, chronic pain, anxiety, and attention deficit hyperactivity disorder, known as ADHD, are more likely to develop depression. Some medical syndromes like hypothyroidism can mimic depressive order. Some medications can also cause symptoms of depression. Drug and alcohol abuse constitute about 30% of people with depression. This requires coordinated treatment for both conditions, as alcohol can worsen symptoms. Depression can present different symptoms depending on the person, but for most people, depression changes how they function from day to day, and typically for more than 2 weeks. Common symptoms include changes in sleep, changes in appetite, lack of concentration, loss of energy, lack of interest in activities, hopelessness or guilty thoughts, changes in movement like less activity or agitation, physical aches and pains, and suicidal thoughts. For more information on this topic, you can contact the National Institutes of Health and NAMI, N-A-M-I. This has been your Apple for the day. Click, like, love, share, follow on Facebook, Instagram, and YouTube at Apple for the Day.